I'm starting to. So welcome all to this session on comparative impacts of the COVID-19 crisis on work and employment. I'll just introduce myself as chair. I'm Tony Dobbins, Professor of Work and Employment Relations at Birmingham Business School in the UK. So we've got 3 presenters today. So thanks very much to the presenters. So I've got Martin Behrens, who's going to present on delivering the good German industrial relations institutions during the COVID-19 crisis. I've got David Peetz, who's going to look at contradictions of control and insecurity during the COVID-19 crisis in Australian and Canadian universities. And last but not least, we've got Christian Ibsen, who's going to present on the issue of do institutions mitigate risks for exposed workers during COVID, evidence from a cross-national survey of Danish and American workers. So these are papers that have been submitted to a special issue I'm involved with for industrial relations, the Berkeley Journal, Journal of Economy and Society. So thanks very much. We appreciate the submissions very much. Obviously, one of the issues covered in the special issue on the impact of COVID on work and employment is it's had different impacts around the world, globally. And a lot of the impacts and how the impacts are responded to depends on institutions and the strength of welfare states and protections. And also obviously the role of the states and how they react to the coronavirus public health pandemic. But having strong welfare states, like a lot of European countries, I think definitely helps in terms of public health response to the pandemic, and also the economic responses in terms of protecting against redundancies. So a lot of European countries have a history, particularly Germany, as Mark would know, of having job and income protection schemes, short-time working schemes, which have an institutional legacy in these countries. So those countries have tended to have greater institutional protections during the COVID crisis. So I'll pass over to our first presenter. Thank you, Martin. So 15 minutes, and then we'll move on to David and then Christian, and then take questions and answers. Thank you.
Thank you very much, Tony, for having me and my co-author, Andi Pekarek from Melbourne. And I have to excuse Andi because for him, this time is quite unfortunate. It's 3 a.m. and I couldn't get him to wake up right in the middle of the night. So I'm representing our team. And I'm sharing my PowerPoints with you in a second. And to give you some idea about my technical sophistication, my nickname in my institute is Catweasel. So hopefully it will work. Okay. Okay, if you could give me some indication, do you see my slides?
I can see it.
That's good. So hopefully everybody can do it. So the major aim of our paper is trying to figure out what's happening to major institutions constituting the core of German industrial relations during the COVID crisis. And we start our paper by looking on these major questions of institutional continuity and change. And we figure that there might be, by and large, two big camps within the area of industrial relations in particular, or in the area of political economy more in general. The one camp is basically assuming that there is a strong case for institutional resilience. And most prominently, of course, we have the varieties of capitalism debate right in the center of this camp of institutional resilience, with their major argument that due to institutional complementarities, we would expect that even under severe strain, such institutions are well and alive. And there's a good chance that they keep that way. More recently, we have, I would call it something like development coming from the VOC debate with authors such as Bruno Payet and Kathy Thean and Anke Hassel as major representatives within that debate. This is the dualism account. So they argue there is substantial change in those systems such as Germany, where you still find a strong center with core institutions such as strong collective bargaining institutions or unions. However, you also see that there's a periphery, mostly in small firms or medium-sized firms from private services, but other sectors as well, which looks much differently, where you barely find those institutions at all. The second camp, we call it the liberalization or disorganization camp, which argues that most of those coordinated systems with strong representation are subject to erosion. And as a result of that erosion, you find many of those institutions weakening or even disappearing. Just take the major works of Baeckler and Chris Howell or Wolfgang Streeck as a representative of this disorganization argument. There is a more fine-tuned variety of this camp, of this debate, represented by Streeck and Thean, Mahoney and Thean as well, which argues, well, institutions might look still at the superficial level the same they used to be look like 20 years ago. However, they're mostly as a part of incremental change, empty shells, and they are basically have lost their ability to help workers, for example. So a major question now is, coming from those debates, if we take the COVID-19 pandemic as a major stress test, do institutions still deliver meaningful outcomes for workers when crisis strikes? So this is what we are going to do. The way we analyze this question is basically coming back to works of Esping Andersen and its famous concept he has taken from Polanyi of commodification or decommodification. Commodification means that workers become replaceable, easily redundant, and atomized, while decommodification, so as the opposite concept, is basically protecting citizens, and in this case workers, from pure market forces. So we have applied this concept by looking on 4 dimensions of decommodification. The first of all is the most obvious one, is the protection of jobs and income which comes from those jobs. The second one is more an issue of health and safety, basically asking whether how long workers can do or be in that employment relationship. A more recent phenomenon which comes along with the weakening of the male breadwinner model is asking how workers are able to reconcile family and work, and is focusing on these work-life boundaries. And finally, also a fourth dimension is emphasizing skill development as a question whether workers can maintain their skills and probably their jobs or improve their chances at the labor market. So let's turn to the institutions. So those institutions which supposedly have the capacity to decommodify labor. In the center of the German industrial relations, and I will get into that only briefly, is the so-called dual system of interest representation, which with strong works councils and unions as key actors, as well as employers associations at the employer side, and collective bargaining. So we have basically two systems. One is a statutory system of establishment level works councils, and above the establishment at the company or even industry level, we have strong multi-employer collective bargaining. So the inner core of this dual system, which gives its name, this system its name, dual, is that you have certain types of interests which are exclusively reserved to the level above the establishment. Collective bargaining is a prerogative of unions and employers or employers association. And so at this level, we find that distributional issues are to be resolved. At the establishment level, works councils as elective bodies elected by the entire workforce and not just union members, is taking charge of issues such as hiring, firing, but also technology, introduction of new technology and things like that. They're banned by statute from negotiating on wages, hours, and working conditions. So distributional issues are reserved to collective bargaining. So in the following, we will focus on these two core institutions within the dual system, works councils and collective bargaining. And as you see below, we find some weakening of both institutions in terms of the percentage of workers who benefit from those institutions or are represented by those institutions. So the question we now turn in a second to is, are those institutions now too weak to benefit or protect employees from commodification or not? So the data we use to run our analysis is based on the survey commissioned by the Hans Boeckler Foundation. So in the last summer 2020, in June, more precisely, the HBS has commissioned a study on employee experiences during the corona pandemic, including all kinds of questions on how the pandemic has influenced working conditions and personal well-being during the crisis. So the study was conducted as an invited computer-aided web interview in June 22 by the Kantar Polling Institute, which is probably one of the largest German polling institute. In total drew 6,111 valid responses, which is compared to the group invited to take part in this survey, a response rate of 82%. So what we have done here for this paper is running logistical regressions with using those 4 dimensions of decommodification I have introduced earlier on as dependent variables, and using collective bargaining coverage and the existence of a works councils in the establishment where the respondent works as a major independent variable. We have controlled all our models for establishment size, industry. We controlled for East Germany because of the institutional transfer which occurred there about 30 years ago. And in one model, the model asking for training, we also control for formal skill levels of workers. So here are the results in short form. I don't want to bother you with all the numbers. So what we find here is in the left column, the dimension of decommodification we have introduced: job and income security, health and safety at the workplace, skill development, and what we call boundary management, so reconciling work and family life. So the variables we have introduced in our model, we have used in our model as dependents, you see in the middle column. So job security is represented by two major variables. We have asked the perception of workers, how they feel that the danger of potentially losing their jobs. And we also have introduced a variable on short-time work compensation, asking them whether the employer has topped up their short-time compensation paid for by the Federal Employment Agency. We have used the dependent variable provisions for home office, so whether such a model is available at all and their regulation at the establishment level for home office, because it is serving a dual function. Home office is, first of all, in the dimension of health and safety, protecting workers from being infected, because at home they're not encountering so many contacts with co-workers, but also potentially enables them to better reconcile work and family life during the pandemic. Finally, we have asked at the dimension of skill development whether workers have taken part in training during the pandemic. So the results on the right-hand side, we find that, as you might expect, that collective agreement, so being covered by the collective agreement, strongly, significantly is benefiting workers, as it reduces their fear for losing their job, but also raising the chances that workers enjoy top-up payments of short-time for short-time work. We also find in the latter model that works councils on top of collective bargaining have a positive and significant effect on the chances that short-time compensation is being topped up, which is remarkable given that this model is also controlling for collective bargaining already. We find that in terms of provisions for home office, Works Council have a strong and significant impact and improve the chances that an establishment is offering the opportunity to take advantage of home office work. And finally, we also find that Works Councils improve the chances that training is available during the month of a pandemic. The influence of collective agreements is not significant in these models. So, as time is flying, I will turn to my conclusions. First of all, we see from these regressions that, in fact, key institutions still help to shield workers from commodification during the pandemic. So even under severe strain, where we have them at all, these institutions still benefit workers. Also, the pandemic underscored the importance of non-monetary aspects of decommodification, for example, skill developments, but also reconciling family and private and work, and also protecting workers from dangers of being infected. Finally, you might feel that our findings support a dualization perspective, as you see, well, where we have works councils, where we have collective bargaining, it helps workers. However, we don't have it everywhere. And so you might find this picture confirmed. However, if you see which industries are supported and emphasized during the pandemic, and which one are de-emphasized, this is not confirming what the dualism literature tells us about what is core and what periphery. In a second, where we feel that more emphasis is given to nursing homes and their employees, employees in retail, they are considered as a periphery, but during the pandemic, they benefit or enjoy some more emphasis and valuation in the public debate. Thank you very much.
Thank you very much, Martin. Excellent. Raises some very interesting issues. So next, around decommodification, and also has COVID led to a reevaluation of what types of labour are important in terms of offering human and social value. And those debates are occurring in other countries. So thanks, Martin. So next up we have David. Thanks, David.
It's actually, Johanna is standing in for David because he is also in a middle of the night environment, although I see his name on the screen there. And so he said he might try to pop in. So if David grunts, then he's present, but
he must be asleep. So
I would be asleep in his shoes. So there's no judgment there at all. All right, just getting all the things on my screen organized. Okay, thank you very much. And I'm really excited to be part of the group that's being considered for this special issue. I think already hearing about Martin's paper, I sense that there's a lot of complementarity across the papers that we're going to hear today in ours in particular. And I think it's neat that we're approaching them from different angles. So can you guys can see my screen there? Awesome. Okay, so this is part of a larger research project with over 28 researchers that David Peetz has wrangled over the last year. There are 14 universities represented, 7 in Canada and 7 in Australia. And it's a subset of the authors that have contributed to this particular paper. So David Peetz, Susan Resha, Glenda Strawn, and Carolyn Troop from Griffith, Marian, Baird, and Ray Cooper from the University of Sydney, Sarah Charlesworth from RMIT, Amanda Coles and Amanda Pyman from Deakin, and then Sean O'Brady, who's at McMaster University, and would have joined us, except he just had a baby boy yesterday, and me. So the question that we are focused on in this paper is really in response to the COVID crisis. How did management control strategies influence workers' job security and workers' effective outcomes like stress and happiness? But also, how did the COVID crisis impact conflict over financial control? And we're specifically looking in the higher education space. So our data is about universities in Canada and Australia. And we use a comparative political economy and also a labor process theory lens to model the influences of these effects. And our framework looks like this. So just quickly to go through this diagram, we've really modeled the landscape and structured our analysis using this idea of a macro, meso, and micro level, a little bit what Martin was talking about of these different levels where institutions operate. And we see that at the top in the macro level, we have economic circumstances and institutional idiosyncrasies, ideologies and policies differentially contribute to the extent of the crisis or to our understanding of the crisis. And that perception of the crisis then frames for management, the degree of financial control that they may require to exert. And so in the context of universities, this translates into the threat or the lack of threat of job loss as universities face austerity environments or threaten austerity environments. And so that leads to a sense of job insecurity for workers that is a place of a struggle for control. So depending on the management choices about how much control they're going to exert over financial information, and depending on union power and choices, we see different outcomes perhaps for the workers who are existing at the micro level. So to examine those elements, we have data from the CHUS survey. So it's the COVID Homeworking for University Staff survey. And it was a survey for both academic staff and administrative or professional staff from universities in Australia and Canada, 7 in each. And we have a total sample of over 11,000 respondents. Slightly about double the number of respondents from the academic or the administrative staff when compared to the academic staff. And many of the sample are unionized in Canada, and about a quarter of the sample is unionized in Australia. That's the data that we really use for the micro level, so the worker experiences. For the macro and the meso levels, we have supplemented the analysis of the survey with an analysis of key institutional differences and developments that we've gathered from various documents and news sources, archival data from unions and their other labor federations. So we were able to obtain signed letters of understanding at various universities, data from unions on polls that they were taking throughout the period. We conducted some key informant interviews with union and labor federation representatives. And then we were also all essentially participant observers in our own institutions. And so we sort of gathered unstructured data in that way, as well as a slightly more structured survey of the research team about what was happening at our universities. So all of that came together to inform our analysis. So what we see at the macro level is that in Australia and Canada, we see that the university sector has been shaped by neoliberal policymaking. We also see similarity in that both countries are geographically large, but have limited domestic student markets. So both countries do rely on international students and have been relying more on international students over the past number of years. We see higher union density in Canada and arguably a more favorable environment to unionism under the essentially the Wagner Act model that we have in Canada and the majoritarian system as opposed to Australia. So we have a lot of shared macro context, but we see that when faced with the COVID pandemic, Australian universities had greater exposure to job loss. And so in Australia compared to Canada, we see that there has been a greater or a deeper longstanding state underfunding of the higher education sector, a greater reliance on international students, a greater entrenchment of neoliberalism, and then during the pandemic, less COVID-related state support than what we saw in Canada. Another difference at the macro level is in Australia, and anyone who was in the talk yesterday heard more about this, was that there was a failed attempt at national bargaining in that context. So the National Tertiary Education Union, the NTEU, and the Australian Higher Education Industry Association, as well as a number of vice chancellors, what we would call university presidents, were negotiating or trying to negotiate this jobs protection framework that would have introduced a bit of trade-off between saving some jobs, but taking some pay cuts or deferred pay. And one key element of that agreement was that universities would open their books, and the degree of tolerated job cuts or pay reductions would be based on, institutionally specific data about the financial state of these universities. That fell apart because there was rejection on both sides. Essentially, managers, administrators wanted financial control. They didn't want to give up that information and open their books. And unions or union members in some local scenarios resisted pay cuts. At the meso level, we're really looking at the university level responses. And so in general, in Canada, we saw that some institutions attempted cost savings early on in the pandemic. But according to one of our respondents from a labor federation, most employers ended up being sensible. And some of the early claims, job austerity claims, were walked back or lessened in various ways. We did, however, see that a lot of shared governance structures were bypassed. So for instance, joint health and safety committees were kind of bypassed in favor of these COVID-specific task forces that were created just for really administrators and senior managers. And that sounds similar to what happened in the US context as well, actually. We see that there was some negotiation with unions, but it tended to be on lesser financial control issues or administrative matters, extending sabbatical deadlines, maybe some top-ups for workload here and there, but nothing concerted. In Australia, the crisis was much more severe. Job losses ranged now across the sector as a whole to upwards of 17,000 job losses. And in that context, there was some negotiation with the staff through branch unions, but in other cases, management acted unilaterally. And on the basis of those dimensions, we actually developed 4 vignettes that are exemplary of these different conditions of what we're calling 2 loci of restructuring. So we were looking at whether job losses were expected in a particular institution, and then the degree of union power. So was there union involvement in decision over job losses? And we've categorized the universities into 4 types on the basis of those 2 dimensions. And we've pulled out 4 exemplary universities, called them universities A through D. University A is in the Canadian context, and the real difference there is that job losses weren't expected. And the survey was conducted in August to September 2020. So among faculty and administrative staff, job losses were not expected, and that presents our university type 1. And so in that instance, there was no need for unions to be involved in decisions over job losses. Where we see a lot more variety on that second factor is in the Australian context, who all did have expected job losses to various degrees. And we see that in the type 2 case, for instance, major aspects of restructuring were negotiated with unions. In the case of University C, the type 3 case, unions were partially involved. And then in some instances, our case of University D, all of the aspects of restructuring were unilaterally decided by management. And so quickly, just to go to the micro level, with the survey data, we see that there was a shift to home working across the board, of course. Signified quite a significant loss of control for some, especially faculty members who are now constrained in their teaching in a variety of ways, but a gained control for others, particularly administrative staff who could now work from home and kind of have a little bit more space away from managerial oversight. We see in general that administrative staff reported more positive experiences overall than faculty. Although a number of people in the sample, 44%, reported decreased job security, and those that average would be worse in the Australian data. So if we connect the micro level findings to the meso level, we see that where job losses were expected, job insecurity and stress were highest where union involvement was the lowest. And we see that job satisfaction and happiness were highest where union involvement was highest. So a little bit of similarity to what Martin was presenting there, that these institutional structures are doing something. And we argue that the university's approach to job protection, restructuring, and engagement with staff through unions appeared to influence the way that the staff then perceived the effects of the COVID working arrangements. So in closing, we find that the prompts for and the focus of conflict in this space were shaped by the degree of the threat. So was there a crisis that was perceived in Australia more so than Canada? How did management respond? Did management decide to forego some control or were they willing to negotiate with unions? This was also based on the extent of the union's ire, or on the other hand, their acceptance of management perspectives, and then also dependent on unions' pre-existing power, and the scope for action really impacted the discussion and dialogue in that space. So ultimately, we argue that there is a contradiction of control for management in the COVID-19 crisis. If they were to negotiate reductions in labor costs, management was ultimately going to lose absolute discretion over finances. And so this case points to issues of control over finance, not just over labor, and is a broader spectrum of the battle for control. And the intensity and the urge for managerial prerogative over that financial control really influenced the choice of administrators to negotiate or bypass unions. the choice to be aggressive was often not proportionate to the given financial or operational circumstances in each of our different contexts. So I will leave it there. Thanks very much.
Thank you very much, Johanna. Very, very interesting comparison of university context in Australia and Canada. Thank you very much for that. Finally, we have Christian. Thanks, Christian.
You see my screen?
Taking a bit of time to appear, I think.
I'm having troubles with Zoom right now. You see, can you hear me? You can hear me?
Yes.
We can hear you. Yep.
All right, let's try again. Do you see my screen? Still no?
Oh, can't see any slides.
Was like coming up, but it didn't show the slides. Just said like started sharing, you know, the black screen.
Yeah, it's just black. It just says Christian started screen sharing. Well,
Christian, it's Christine. I have the slides, the latest version you emailed. Do you want me to put them up and you can just tell me when to advance?
Sure.
Okay.
thanks, Christine.
Sorry about that.
Oh, don't worry.
All right.
Is that working?
Great.
There.
Yeah. All right. Thank you very much, Christine. So we are also a big group of people who came together and did this comparative study of the effects of work arrangements in institutions on COVID-19 anxiety and insecurity. So we decided to do 2 surveys, one in Denmark and one in the US, on workers' perceptions of their situation during COVID. So we were a team from Illinois, that's Christine and Ryan, and we were a team from Michigan State University, that's Hejin, Maite, and I used to be there, but now I've moved to Copenhagen, and I've joined Jonas Torbøl and Hjalmar Bang Carlsen, who are not here. So next slide, please. So the motivation for our study was really to look at the issue of work and employment during the COVID crisis. And we started off from the observation in the media that the virus really induced anxieties and insecurities unevenly across different individuals and different groups of workers. And we then decided to say, okay, there's been a lot of studies on anxiety from sort of more psychological research, but we wanted to look at work and employment as an important source for this uneven distribution across individuals. And we wanted to look at economic insecurity as well. We also knew that there was an uneven political response across countries. So not only did the virus hit unevenly across countries and individuals, there was also different responses. So this goes to the macro level that we've just heard about in the 2 preceding presentations. So next slide, please. So we asked these 3 interrelated research questions. The first is, to what extent do differences in employment arrangements affect individual anxieties towards COVID-19 and economic insecurity during the pandemic? And then we also go on and ask whether or how these individual anxieties and economic insecurities differ according to political context. So this would be Denmark and the United States, and I'll tell you a little bit about why we chose those contexts. And then thirdly, to what extent do unions affect individuals' perceived anxieties and insecurities in each context? So we're all employment relations scholars, and we really wanted to know, well, do unions affect these things? And Martin and Johanna had already alluded to that they do have some kind of effect. Next slide, please. So the first thing that we wanted to look at is of course these frontline or essential workers that have been so much, there's been so much focus on them, and we wanted to look into whether we could observe higher anxiety and insecurity for these workers across these two different contexts. So other studies have shown that there was, that there was a higher risk of infection than remote workers for these workers, and they also have a higher prevalence of stress and depression and anxiety during COVID. So it kind of makes sense, and this is a kind of a no-brainer hypothesis. Frontline essential workers will experience higher degrees of anxiety. But then insecurity, economic insecurity, we were sort of torn because for some frontline or essential workers, actually, they will have higher employment security during COVID. So we were a bit ambivalent about whether that should actually be by our hypothesis. But we said that they would perceive higher degrees of insecurity as well. Next slide, please. Then we talked about employment arrangements, and here we sort of departed from the sort of typical atypical workers split. We can discuss at length who falls into what bucket. We try to be as conventional as possible. And other studies have sort of shown that these atypical arrangements are typically associated with negative work outcomes. So this should also apply under COVID, and maybe even more so. So we said that non-standard workers will experience higher degrees of COVID anxiety and insecurity. Next slide, please. And then finally, we came to unions and some survey evidence from the US that we looked into. This is a study by Hertel Fernandez et al. From 2020 said that union members are more likely to report using protective personal equipment or PPE on the job, adhering to social distancing guidelines, having access to paid leave, receiving employer resources for disinfections and sanitizing, and getting tested for COVID-19, even adjusting for demographic and workplace factors. So we hypothesized that unionized workers will experience lower degrees of anxiety and insecurity, to see if this actually bore out in our samples. Next slide, please. But then we also wanted to see if there was some moderation going on. And the first was to look at, well, maybe you could get sort of a double whammy effect of being both non-standard or atypical worker, plus being in the front line or being an essential worker. So this would strengthen the positive effect of being in the front line in both contexts. So that's hypothesis 4. But then we said unionization should, in general, weaken the positive effect that we see for both these groups of workers, both the front line and the non-standard workers. So that's hypothesis 5 and 6. Thank you. Next slide, please. So we had 2 original survey data that we collected in Denmark and 2 states in the United States, so Illinois and Michigan, where we're based. So I could say that we had sort of a very sophisticated case selection strategy, but the reality of it was that I knew these guys in Copenhagen. They had done this great study, and then I said, shouldn't we do this in the US? And then luckily people thought that was a good idea. I hope they still think it was a good idea. But we sampled through Ipsos, a web-based panel. We sampled 85 individuals in the US. And then in the final sample that we actually used for the analysis, we had 696 adults who had worked in any capacity for pay since March 1st, right? So that was sort of, the survey was about more things than we actually analyzed it for this paper. And in Denmark, the sample was substantially larger, but for the analysis, it came down to 1,370 individuals, and this was done through the Danish statistics So there's like an almost communist-like way to do surveys in Denmark, which is very, very nice for research. So a lot of ways to do surveys there. The other thing, to be serious, the other reason why we also could use these cases was that they're most different settings, right? Extremely different on almost any employment relations indicator or dimension that you can find. And their COVID responses have been quite different. So Denmark, tripartite agreements to protect jobs and income, tons of money being poured out to make sure that people wouldn't lose their jobs, and they by and large didn't. Whereas in the US, there was this very sort of decentralized response. Every state was on its own. You had some federal stimulus checks, but by and large, you know, we would argue that compared to Denmark, workers were more on their own than they otherwise would be. Next slide, please. All right, so the variables that we looked at, COVID anxiety, we had 5 discrete survey items that we then used to make a latent factor variable, and it basically asked the respondents, well, how much, you know, if you consider your experience, how much has it been fear-inducing, worrying, something that affects all my aspects of my life, something that I think about all the time, and something that makes me feel helpless. So this was sort of the anxiety part of it, so the affective side of it. And then we talked about economic insecurity, and that was questions about, have you received help, for example, unpaid help from others, excluding federal or state provided benefits, with any of the following since March 1st. So this was sort of to say, had COVID sort of made you in need of help that didn't really cover all of your needs. So that was the insecurity part. And then the independent variables that we looked at was the standard non-standard distinction. We talked about frontline and essential, and here we used a variable for the capacity to work from home, and then union membership is sort of a dichotomous variable for yes or no. Next slide, please. So these are our results. For the 6 hypotheses, we had some that were main effects, and then we had some that were moderating effects. And if we just go through the first 3, we could see that on the COVID anxiety dependent variable, we really didn't find a lot of support for our hypothesis this was somewhat surprising to us, to be honest. We had expected to see anxiety, at least for the frontline essential workers, but also for the non-standard. We were less sure about the unionized workers, and that was ironically the hypothesis 3 was the only support we got in the US sample. For hypothesis 1, we found the opposite, that actually frontline and essential workers experienced lower degrees of anxiety in the US. So that was the opposite direction, if you will, but a significant result. If we go to COVID insecurity and the main effects, we did find support for our hypothesis. So both frontline essential workers, but also non-standard workers, experience significantly higher degrees of insecurity in both the US and Danish sample. So this really shows you kind of like, this is a robust finding, right? This applies to these very different settings and contexts. If we turn to the moderating effects, we saw, we didn't do that for the anxiety analysis, but we did it for the COVID insecurity analysis. And here we actually, again, saw opposite results of what we expected in the US for H4, which was the non-standard plus being frontline and essential workers. But we also saw it for unionization. Actually, the unionization variable strengthened the positive effect of non-standard work on insecurity. So we were trying to make sense of this, and we do so in the paper, and I won't go into details with it here, but we have some contextual explanations for why we define these counterintuitive results in the US. Denmark, by and large, fits our expectations better, and here we see this double whammy effect of being both non-standard and frontline that increases insecurity. But we also see that unionization dampens or weakens the positive effect of frontline essential work on insecurity. But we didn't find this for non-standard work on insecurity. Okay, next slide, please. So, you know, we try to make sense of this, and as I said, COVID anxiety does not seem to be driven, at least not in our study, by workplace factors, at least not in the way that we've done it in this sort of, albeit coarse way, but insecurity does seem to be driven by workplace factors, and as I said, I think it's a strong support that we find these very similar results across two very different political economic contexts. You could have maybe thought that in Denmark you wouldn't find these insecurity or effects on insecurity from these two workplace or work arrangements. But we actually do. Unions played a role, but only in Denmark and only for frontline and essential workers. And so these moderation hypotheses only really held in Denmark. And as I said, we talk a little bit about it in the paper, but some of these non-results might be due to insufficient statistical power for the US sample. So that's something that we need to keep in mind. Next slide, please. So in conclusion, you know, some workers do take the brunt of the negative labor market effects during COVID-19. We do find some support for this idea that strong institutions and organizations can mitigate some of these negative effects. I haven't said it, but in the descriptive statistics that we provide in the paper, we do see that insecurity is by and large higher in the US than in Denmark, right? So this is clearly something that we also need to take into account when we compare these two data sets. It'll be important to follow the long-term effects of COVID-19. I think, I mean, we take a snapshot and we did it last year, but really to see what the long-term effects will be is important. And here I think there's a strategic choice issue as well about how employers and trade unions will adapt to or use COVID-19 in their favor, right? So there might be more focus on health and well-being, there might be more working from home, and we would have to sort of see how those things, how those choices will affect insecurity and anxiety in the longer run. Okay, next slide. Thank you very much.
Thank you very much, Christian. Three very, very interesting presentations, so thanks very much. They indicate institutional variations between these various countries in terms of the work and employment implications of COVID-19. So I'd like to give you the opportunity in the short time that's remaining to answer any questions. If you can put your hands up on or put your questions in the chat.
Tony, if I may ask a question directly to Christian.
Yeah, sure. Go ahead, Martin.
Christian, thank you very much for your excellent presentation. I loved it. Just one suggestion or idea, so why you didn't find much in terms of anxiety. Of course, anxiety is also a function of what you expect, right? And I don't want to be cynical, but if you're a trained atypical worker or frontline worker, you might be trained how to take pain to some degree. So and it's also a generational issue. What we find in several German studies, if you compare different generations of workers, if you compare the generation 30 and younger with the more older worker 50 plus, you feel that the workers 50 plus have a harder time to deal with such an anxiety of a fear of losing a job, while this new generation, which has lived up with temporary work and grew up with temporary work and all these kind of different things, they made their peace with that, right? They say, well, I don't know anything differently, because now all my career, when I left school or left university, I've moved from one temporary job or agency work to another one, and it's just a matter of life for them. And so we find these strong differences between different generations. Do you have in the data set an opportunity to include the age of people? Because this might help to strengthen the results.
Thanks, Martin, and I should have mentioned all the controls. I mean, we do of course control for age, gender, education, stuff about your general risk perception. We also include that. So whether or not you're sort of a risk-averse person, we talk about social capital. We also have that in there. Political factors. But having said all that, I think at least, and maybe my co-authors feel differently, but I felt a little bit out of my element when we were talking about hypothesis for anxiety. Because I do think those are factors that's an outcome that can be explained by many things that I'm not well versed in, but maybe my co-authors will say that they are. I think if we maybe for the Danish data set, we could slice up the data much more fine-grained and look at particular occupational groups and age groups and see if we can sort of toy around with it. For the US data set, I think that might be hard to do. But we do control for age, gender, educational level. So yeah, thanks.
Yeah, I think David has made a similar points in the chat, Christian, if you'd like to, in terms of the feedback for David's question.
Yes, I was basically saying that some of these findings of not finding the effects you're expecting could be due to selection issues and so on, like people who are too worried by COVID, not wanting to be in a frontline job. A lot of unions here will tell you that the rate of people joining unions has increased substantially since COVID came about because of people's insecurity. And so it may well be that the union members that you're sampling have got a higher rate of insecurity. We know from other studies they've got higher rates of job dissatisfaction and so on. So that might be like mixing in with the results there, I suspect.
Thanks, David. I can see Johanna's got a hand up.
Thanks, Toy. Yeah, I was just picking up on this same conversation in our data too, and we didn't get into it in the presentation, but it's in the paper. We looked at the kind of 3 vignettes or the 4 vignettes with regard to happiness variables as well. And strangely enough, the Canadian respondents were less happy than the Australian ones. So the Canadian respondents said that their happiness decreased more than the Australians. And this is despite the fact that the Canadians were not facing this massive threat to their jobs while the Australians were. So maybe, just to kind of reinforce this idea that there may be something around that idea of expectation, and Canadians maybe were a little, they were taking life a bit for granted and they had things kind of okay. And so that when a change came, it was a more dramatic shift than maybe the environment with the Australians, particularly the academics, who already were feeling kind of increasingly icky about their job status. And then this was just part and parcel. So that these, funny little variables that are hard to capture and explain.
Thanks, Johanna. Yeah, I think there's a point there. Maybe people in countries like, maybe more neoliberal countries like the United States, the UK and maybe Australia maybe have more of an inbuilt expectation of uncertainty compared to countries where there are greater institutional and historical protections. Any other questions? I see we've run out of time, but if anybody urgently wanted to present a final question for any of the speakers, a quick question if there are any. Otherwise, I think we best wrap up because I know there's a session 15 minutes after this one. Really enjoyed the free papers. So thanks everyone for presenting and also attending this session on the impact of COVID on work and employment. I haven't made any final decisions yet on the papers because we're waiting for all the reviews to come in. But it shouldn't take too much longer. Yeah, fingers crossed.
Thanks for pulling us together, Tony. Bye, everybody.
Thanks, Tony. Bye, everyone.
Thank
Thanks
you.
for Ryan. Hey, Ryan was the organizer. So,
Oh.
Thanks, Ryan.
Yeah, thanks to all of you. Yeah, great work.
Take care.
Bye.
Bye.
Hi, Tim. Thanks for joining. They're just concluding theirs and then ours will start.
Good afternoon, isn't it? Can you hear me today?
Yep, I can hear you. Hi, Brant. Hi, Tim. Hi, Birgit.
Hi, everybody.
Hi.
I kept getting some other meeting. I was trying to come in advance and I don't know why that happened, but anyway.
So the way that Lyra has this organized, there's like 5 or 6 breakout rooms. And so every hour it's the new session in that stream. So that's why next to ours on the program, it says, what does it say? Breakout stream 2. So we're just in a breakout room that's been used all day for these concurrent sessions.
Okay.
I thought it was a kind of interesting way to do it rather than trying to assign some 50 odd panels over 4 days, their own Zoom room, which would have been a disaster. Like, I think this has gone pretty well.
I just kept popping into somebody named Tony Robbins or something like a room or Dobbins.
They would have been fine with you joining. You could have listened in, I'm sure.
I was afraid my face might pop up and just disturb things or something. Sorry about that.
So nobody is sharing slides, right? So we don't have to do like a, okay, I didn't think so. All right.
No, but if you're interested, we did a 4-minute, today is World Oceans Day. And we did a 4-minute.
Is it?
Yeah, and it's on the ILO website. If you just click on World Oceans Day, you can see our little video, which is